Welcome to Utah Stories. Today on the program, we are going deep down the rabbit hole, probably deeper than we've ever gone, into the answers to the questions that have been plaguing me for a long time on this program. If you are new to Utah Stories, we've been following homelessness and housing now for about 17 months. And it's just become my passion project. I have all these questions, and every time we ask more questions, we get more questions, and I feel like I'm trying to unravel a ball of yarn and untangle it. And I'm really excited to have on the program with me Paul Webster, who's the new executive director of the Pioneer Park Coalition, who actually has one of the answers to one of the biggest questions I've had for so long, which is, why are we copying the failed policies of California, Oregon, and Washington when we know they don't work, but we're doing exactly what they do? Thanks for being on the program, Paul.
Thank you, Rich. I appreciate it very much.
So the short answer to why we are doing the same failed policies, copying them in our homeless policy here in Salt Lake City, what's the answer to that?
Well, you know the old adage is follow the money. So the money is part of the federal policy on homelessness assistance that Congress has authority over. HUD, the Department of Housing and Urban Development, has they administer. And so what's happening and what's been happening probably over the last 10 years is a shift in federal policy and how the federal government provides resources, money to communities to address homelessness. And those policies have significant impacts in communities. They have significant impacts with the government in terms of how they prioritize what they prioritize, and also in terms of what programs can and cannot do. And really, also very importantly, is how programs and governments understand what's going on in homelessness in terms of data.
Mm-hmm. Yeah, and the most revealing thing that you told me that I was unaware of is the housing first policy. It's failed everywhere in terms of how they do it, how they roll it out. There's no strings attached. You're going to work on your bigger issues. You're not going to get kicked out, and it's not merit based at all. You don't pay rent. And what we've seen happen in Salt Lake City is the complete deterioration of Palmer Court, Magnolia Apartments, all of this permanent supportive housing, these housing first units. They deteriorate because there's not the wraparound services that I'm aware of. The people there, according to the manager of the Magnolia Apartments, they say everybody here is using drugs all day long. And it's not at all, your ability to stay in your unit is not at all tied to your performance in going out and getting a job or getting off drugs. And that no strings attached policy has completely failed in California, Oregon, and Washington. And what you told me is that that's mandated by HUD to have it be no strings attached?
That's right. So in 2009, Congress reformed the underlying federal law on how federal dollars are provided to communities to address homelessness. Mm-hmm. Previous to 2009, there was a whole variety of different programs. In fact, in 2009, Congress consolidated, I want to say about 9 or so different programs into about 2 or 3 different programs. And in so doing, they made policy choices and policy decisions. Probably the biggest policy decision that they made was, we're going to treat homelessness as a housing problem only. And if you're a federal agency who is in charge of administering grants to communities to promote housing, it makes real sense. So I like to say that that we're dealing with 2 challenges. The first challenge is how the federal government considers what communities need in terms of homelessness assistance. And the other challenge is what communities actually need, some of which the federal government may help with, some of which the federal government may hurt with, and some of which the communities need to come up on their own. So we're kind of in between these 2 needs, one from coming down from the federal government, the weather from coming up from the community, what the community needs. But specifically with respect to this policy, and some people call it housing first, my view is that housing first is simply an approach. It's a good theoretical approach.
Yeah, it makes sense in theory.
Exactly.
Absolutely.
We haven't seen a whole lot of success, but that depends on what you consider success. Mm-hmm. So if you're HUD or if you're a housing first advocate, your measure of success is getting people into housing. Mm-hmm. If you're someone else, then your measure of success may be, how do we get more people off of the streets? That is a different question. And then there still might be another measure of success, which is, how do I get people off the street? How do I get them into housing? And how do we help them transform their lives, rehabilitate, become self-sustaining? Those are all three different objectives, and this is one of the challenges with the complexity of homelessness, is everybody is talking about their own version of success, not understanding the underlying public policy.
Yeah. And so the success from the federal government's point of view is, if you're homeless and you're getting a free housing unit, regardless if you're dealing drugs out of that unit or doing sex trafficking, you're a success.
They measure success by what's called housing stability. Now, I do need to correct you on one thing, that most permanent supportive housing does require a 30% payment for rent. The interesting thing about that is usually homelessness housing providers will qualify their participants for SSI, SSDI, and because one of the requirements for people to access permanent supportive housing is that they have a disability. The interesting thing is, in HUD's policy land, simply being chronically homeless and having a substance abuse disorder qualifies you for a disability. Now, the interesting thing is that because, and this is what we were talking about, going down the policy rabbit hole, right? Mm-hmm. Because HUD policy is focused on increasing housing stability and getting people housed, they treat their participants not as folks who necessarily have significant needs, even though they talk a lot about that. They treat them as tenants. And as tenants, they are now landlords are now subject to the Fair Housing Act. The Fair Housing Act was a piece of federal legislation that was intended to protect various folks with respect to race, gender, disability from discrimination. In other words, how come I can't rent that apartment? I should be able to. I'm just as much qualified as anyone else. What the federal government has done with their homeless assistance programs is that they have used the Federal Housing Act almost as an entitlement to say, look, somebody who is seriously addicted, somebody who has untreated mental illness, somebody who is engaging in criminal activity. Now, criminal activity is a cause for eviction, but for the most part, they're like, our goal is to get people housed. We will provide the quote-unquote supportive services around them to keep them housed, but we will prohibit landlords from requiring anything of the tenants, just as if you were renting an apartment. And I've had people ask me, they said, well, Paul, if you are renting an apartment, why would your landlord require you to take a sobriety test? Mm-hmm. And I would say, well, they wouldn't. They wouldn't have to require that. So why should we require our homeless neighbors to do the same thing? And my response is, because when I apply for an apartment, I'm using my money for the down payment, I'm using my security deposit, I'm using my good credit to protect the landlord from liability that I may cause. Mm-hmm. But what's happening with HUD's view on how they view participants in homeless assistance programs, the government, in other words, the public is taking on all that liability, but the federal law still is essentially treating those individuals as tenants. And that's one of the big changes happened in 2009.
So if I understand you correct, as a tenant with tenant rights,
You can't evict me for smoking dope or using drugs.
You can't say, oh, that meth is destroying the unit. I can't kick you out.
Well, now you can be evicted. You can be evicted for not paying the rent, but remember, a lot of these individuals are covered from an entitlement. You can be evicted for engaging in criminal activity, and you can be evicted for destroying the property. So there are those
So these people using drugs all day long at Magnolia, they have a right to kick them out, don't they? Under two of those three guidelines.
It depends on how much the landlord wants to go in there and say, you're doing something illegal. What does that mean? That means I got to call the cops. What are you going to call the cops on? Well, I know that this person is using illegal substance in my apartment. Okay, how do you know this? The cops have got to come. They got to go through all that rigmarole. Just the way that things work on the street with respect to homeless assistance programs, they're like, look, if I can get people in housing and keep them in housing, we're going to do that. Now, it's interesting that you mentioned California and some of these areas on the West Coast, because during COVID, what you saw was these program providers so desperate to keep people in housing, because remember the narrative was, we've got to get people off the streets. We've got to get them into individual units so that we can protect against the spread of COVID. Remember that narrative? They were so desperate to accomplish those goals. In some places, like in San Francisco, they were providing drug paraphernalia so that people could actually get high in their government-sponsored apartments. And that's one of those, kind of, oh my gosh, kind of scandalous, scandalous stories. And that's the challenge. So the challenge is, when your objective is to increase the number of people who are stably housed and are keeping in housing, then you're going to have very different program objective goals and outcome measures than if your objective was, how do we help these people become more productive citizens? How do we increase their stability? And let me tell you, there's we know this for a fact. The California Policy Lab did the largest survey ever. In 2019, they did a survey of 64,000 people who are experiencing unsheltered homelessness. Now, HUD's data suggests that there's probably over like 550,000 people across the country, so 500,000 people who are experiencing homelessness. California Policy Lab did a 64,000 person survey. That's better than 10% of the population of quote-unquote HUD's universe of people who are doing homelessness. Out of that survey, they found that 78% of people self-reported that they had some kind of mental illness condition, and another 75% self-reported they had some kind of addiction condition. So what that tells you is that the significant population of folks who are on the street that need housing, get into housing, have some mental illness and some addiction problems. The challenge that we're having is because the federal government, through its regulatory and the requirements for its money, they pay lip service to these folks. And we know that a number of these folks, the untreated, severely mentally ill, the chronically addicted, they're not suited for being in apartments. And so we have refusal to enter into shelter or housing. We have challenges once they do. And so what the federal government is doing is it's using housing as the panacea, as the intervention for clinical challenges. And a lot of those individuals, a significant number of those individuals, they're not going to become self-sufficient. So what do we do with them? Well, the federal government is saying, well, we're just going to treat them as tenants, as someone else. They may have some additional needs. We'll try to provide some kind of supportive services, but it's really up to the participant to determine whether or not they want to participate in those services, whether they want to get clean, whether they want to seek treatment for their untreated mental illnesses.
Well, and it seems to me there's no reward for becoming productive. There's no reward for getting
There's
clean.
no incentive at all.
And conversely, it seems like you're punished if you're in a permanent supportive housing situation and you're able to go out and earn more money. They're automatically going to be taking a third of your check. So why would you want to go out and increase your pay if you're just going to be paying more of that
Yeah.
to the government.
Yeah,
it's like there's built-in systems to keep people not working and keep people addicted.
You're exactly right. And between the program of the federal government that will automatically qualify people who are chronically homeless and have a substance use disorder, oftentimes they have other kinds of disabilities as well, physical disabilities, medical disabilities. What's happening is we're actually providing assistance and support for these people. I'm not suggesting we shouldn't. I'm just simply saying that the culture is one where we're increasing dependency without any understanding of sustainability for subsidizing this dependency. We're using very expensive interventions with respect to permanent supportive housing. Housing is probably one of the most expensive interventions out there. Now, and the rationale was at the beginning, well, it's better to put somebody into an apartment than have them continue to circulate through emergency rooms with addiction problems, with serial inebriation problems, with untreated mental illness problems, with other kinds of challenges. It's cheaper to put them in an apartment than it is than circulating in the emergency room. Mm-hmm. The problem is this: we got both. We got people in apartments, taxpayer-subsidized apartments, that are not having good outcomes, and we're having the same folks that are circulating through emergency services, emergency medical care. And so we're getting both bills, and the federal policy is trying hard to make it work, but it really wasn't even designed to address that in the beginning. And let me just say this other thing is the expectation from the community, the expectation from the public who doesn't understand the complexities of the federal policy. They don't understand the complexities of how Medicaid reimbursement works for people who are seriously ill and untreated, who need treatment. They don't understand these complexities. All they see is more and more disorder. All they see is more and more people who obviously need help and aren't getting help, and more homeless encampments. And so they direct their attention to the local government, and the local government just has part of this picture when the federal government is really dictating a lot. So when people ask me, they say, well, Paul, what is the problem of homelessness? I say it's a policy problem. Mm-hmm. It's not a funding problem. We have more money than ever from the federal government, from states, and from localities going to try to house and assist people who are experiencing homeless. We have more capacity than ever. What that means is that we have more shelter beds, we have more permanent supportive beds, we have more outreach services, we have more capacity than ever. But yet, when you look year after year after year, particularly in that one challenging population, the unsheltered, we're seeing increases in unsheltered population year after year after year. Mm-hmm. When I was here in Utah at the State House a few weeks ago during the legislative session, Pioneer Park Coalition representatives, we now have changed our name officially to Solutions Utah. So we want to get away from just that parochial kind of understanding of just Pioneer Park, but something that's a little broader and more accessible to everybody. But Solutions Utah representatives, we were talking to state representatives, and the consistent message that we heard was what we're doing now is not working. Yeah. And so the time is ripe for new policy ideas.
And I've had on a couple folks from Pioneer Park Coalition before. I had on Scott Howell, and then we had on Jim Buchanan. Mm-hmm. Great, and I like overall what the initiatives are, because you guys actually are using data and solutions, where I don't see that coming from the Road Home, and I don't see that coming from Unsheltered Utah and the city leaders. They're not talking about data, and they're not talking about solutions, and I've invited them on this program, and they don't want to come now, because this is all truth-based, and the data speaks for itself. If you look at the number of police reports filed around the new Magnolia apartments, right, it's skyrocketed since it opened. That data speaks for itself. There is so much drug trafficking and deterioration of not only that neighborhood, but every neighborhood where you have a homeless resource center. Those neighborhoods, the ballpark neighborhood, right, the bees are leaving. Yeah. That neighborhood's completely deteriorated ever since the Gail Miller shelter opened right there, not too far from the Gerald E. King, and now you've got crime everywhere. You've got a magnet for drug trafficking, sex trafficking, you name it, murder, and it seems to me that we're following a failed policy. As you said, it's a policy problem.
Mm-hmm.
Why don't we, as Utahns, decouple ourselves from the federal government, from the federal money, and say, we're not going to do this stupid thing? Why don't we do housing first like the Finns do it? And in Finland, you have to have a job. You have to show results. You have to be getting on the right path to maintain your housing, and you have to pay rent.
Yeah.
And that seems like a no-brainer to me. But what's stopping us from just decoupling from the federal government?
Well, there's a couple of things. When it comes to the impacts of the provision of homeless services, whether or not it's an emergency shelter, whether it's permanent supportive housing, whether it's outreach workers going into homeless encampments and providing whatever services they are. There's at least two things that are going on. One thing is not really the fault of the federal government, and that's just kind of some of the recent impacts that have happened across the country. This is not just unique to Salt Lake, and that is when in 2009 again, when the federal government changed homeless policy, they had this assumption that if people were homeless, get them housing. That was the assumption. That's what HUD was working on. That's what HUD's job is. At the same time that was being implemented in the 2010 to 2013 era, we saw, independent of federal action or anything, we saw a tremendous influx of very powerful, very addictive, and very cheap and available methamphetamine and fentanyl. So at the same time that we were working on kind of this housing-centric approach to addressing people who are experiencing homelessness, we also saw this huge influx of very powerful illicit drugs coming up from our southern border. At the same time, we saw a significant shift culturally in terms of, and you could call it kind of social justice policing, you could call it kind of the aftermath of Black Lives Matter or defund the police. And, some folks on the defund police say, we're not saying give less money to the police. We're saying let's change the way we do policing and let's focus on, intervention and outreach and maybe compassionate intervention or things like that. But my point is that all three of these things coming together, this kind of different kind of way of approaching prosecutions and approaching crime, particularly property crime in general, and drug crime. Different approaches to that has happened over the last 10-some years. We've had these significant increases in the availability of very powerful, very addictive substances, and we've had this different approach to how we address people who are experiencing homelessness, often who are engaged in the criminal justice system, often who are engaged in substance use disorders. So the whole thing has kind of become a real albatross on the neck of municipalities. The federal government's continuing sending the funds to the communities. The municipalities are having to do the cleanup, and that's a real problem. Mm-hmm. So, but I like what you're saying, and I think what we need to really start thinking about is a very simple concept, and that is, how do we incentivize participants who receive federal benefits to have skin in the game? Mm-hmm. How do we incentivize them to say, look, we are providing something that's very valuable. We want to improve your lives, but you need to have skin in the game. And we do this in the federal government. If you receive a Pell Grant, you have to show people that you're going to school. You're getting certain grades. Yeah. If you receive temporary assistance for needy families, welfare benefits, you have to show I'm either getting a job, I'm going through job training, I'm in school. There's certain aspects of how skin in the game policies actually work to improve the lives of the participants who are receiving these benefits. And we need to do that. In my view, we need to have a much more robust conversation about integrating our housing and our programs for people who are experiencing homelessness with the overwhelming needs that we see that population have, which are substance abuse disorder and challenges with mental illness. Mm-hmm. We need to start coupling treatment with housing and homelessness services because that's what those people need. And
Yeah,
if we,
and I just think, like, I talk to homeless people who are unsheltered, and one couple I talked to in Sugar House, they were camping in the park. They were like, yeah, we're not going to the shelters.
Shelters are unsafe. They're dangerous.
They're dangerous. They're unsafe. And also that we have a thing we have our drugs. We like to do them. That's always a problem. But then they say, why not make it so we can have a piece of property? I'm going to show a little clip for you now.
Mm-hmm.
This is Johnny from. I just interviewed her a couple weeks ago. She's been homeless in Salt Lake for 15 years, and she tells me that what is stopping her is this constant harassment by the police, this constant abatement policy, and I'm going to play the clip for you now. She can speak for herself.
What did they steal from you?
They stole $125 and whatever else they wanted. It's not easy coming up with, I don't work, I don't get SSI, I don't get food stamps, I don't get none of that.
Why not?
I don't know. The SSI got cut off between moves, so I have to start all over again on that.
It's probably hard to get your check mailed to you, I'm sure.
It's just hard, period. I mean, I don't have a permanent address, so...
So you are the definition of chronically homeless. I thought they were putting all those people up in free housing.
Yeah, okay. Sure. That'd be nice. They've skipped over my, according to my caseworker, they have skipped over my name for 25 years.
Do you know why?
They have no reason, they have no idea why.
Huh. I'm having a bunch of the people who sit on the homeless task force.
Is that on there?
I don't know who that lady is. Why does it do that? That's weird. I don't even have a pod for it to be creeping like that.
I want the mayor to come out here and spend 1 week with us and see if she can handle it. Come out here with absolutely nothing. No money, no tent, no nothing, and see if she can handle it. It's
So what Johnny was saying was that she's been on the streets for, I think she actually said 30 years. I think I misspoke. But she's losing her birth certificate because of the abatement. You leave your tent, you could come back, all your possessions are gone. Our current policy in Salt Lake City is enforce no camping, and the state legislature just passed another resolution that they'll give money to Salt Lake if they keep enforcing no camping.
if there's room in the shelters, there's a caveat there.
Yeah, and it's like, so what I keep finding is these people don't have documentation. They can't even get on the list. They can't work with the caseworkers. They don't have a postal address. What is going to happen in the next year that's going to help all these people that are camping outside in Salt Lake City?
Probably not a whole lot. And the reason is because this is a complex problem that has been happening over the last, I would say, 50 or 60 years in terms of federal and local policy, and it is culminating now, and it is turned into this human crisis. And what's and I say that it's culminated over the last 40, 50 years. I like to think of it in terms of 4 different buckets or 4 different kind of pillars or ideas. One of them is housing policy. Everybody is right when they talk about, well, we need more affordable housing. Well, this is not just, Salt Lake City, it's across the country. We need more first-time homebuyer housing. We need more middle housing. We need more deeply affordable housing. We need all types of different housing. There are public policies with terms of regulations.
Well, let's look at that bucket first, the housing bucket, because what happened at the beginning of the turn of the century in New York City? I'm looking at that right now.
Mm-hmm.
They had an explosion in population. They had a huge homeless and people who just couldn't afford housing. they started allowing tenement housing, which is not zoned, not allowed in the United States any longer, where you could just have a room and you could share the bathroom and the kitchen. Why couldn't we use a free market solution and just allow that kind of housing to exist again?
That housing does exist still. So there are places like rescue missions and other kind of congregate care places where those places exist. Shared housing, a lot of sober living housing are kind of the similar thing.
And
it
nowhere
really,
near enough of that, obviously.
Well, of course
for
not.
the
Well,
demand.
because they're disincentivized. There's no real market for it outside of the public government saying this is a way that we can address the challenge of too many people and not enough places to go, right? So one of the real obstacles to that is HUD's policies with respect to what is adequate housing standards, occupancy standards, things like that.
You can't have more than 3 people in one dwelling that you're not related to. There's the current law.
There are all kinds of there's square footage standards in terms of the number of people with square footage. This is what's really fascinating about like the whole tiny homes concept is HUD will never fund a tiny home because it's substandard housing. Yet tiny homes have become the darling in terms of some kind of solution for homelessness. Tiny homes are, in my view, are not necessarily the solution for homelessness, but they're a solution for expensive housing. So
For cheap housing.
They're cheap housing. They're cheap substandard housing that we can create. I can create.
And the homeless love the idea of a tiny home. They
do.
love the idea of 4 walls on
Privacy
a piece
is
of ground.
a huge priority.
And even if it were an insulated tough shed, it seems
That's
like
right.
a lot of
That's
them
right.
would love that.
My view is that you can have a tiny home, you can have a safe parking lot, you can have sanctioned campgrounds, you can have permanent supportive housing, you can have shelters. All of those things are great to get people out of the cold. The thing that's important is the intervention. How are you going to move these people with intensive case management and specific wraparound services that meet their individual chronic needs to move them from substandard housing into something where they can actually afford the rents, they can share spaces. This is this is part of the challenge.
Aware of like the Other Side Academy,
Absolutely,
and their model. And the Other Side Academy is breaking ground, I believe, this week on the.
Yeah, they did it on Wednesday.
Yeah,
the Other Side Village.
Yeah, and it's awesome. And I had Samuel Grenny on this program, and what he said, and I quote him a lot because it is exactly the main problem. We've wiped out the bottom rungs of the socioeconomic ladder.
Absolutely.
How do you expect somebody to climb up if there's no rungs that exist there?
That's right.
And I talk to restaurant owners, they can't hire dishwashers or prep cooks in Salt Lake anymore. It's too expensive for them to even pay the person $20 an hour and be able to live here.
Yeah.
And so with those rungs wiped out, it's decimating small businesses. We've seen so many restaurants close, not because of supply chain or the lack of demand. It's because they can't hire
the economics.
workers.
And so what you're really talking about is a very large issue that is the regulatory, the supply and the demand on a vital part of our segment of our economy, which is housing. How do we create these kinds of housing, the kind of housing that's needed that fits the needs of the community when you have so many regulations? In California, you've got regulations, everything from must be have some kind of solar or some kind of green energy in order and you have to have low flow toilets. You have to have all kinds of different amenities. They're mandating to states or mandating to cities that if you can provide affordable housing, then we can usurp the local zoning and the local planning commission requirements. So, they say a lot of things happen in California and move east. So there's this concept of housing as a policy issue that's a real problem. And I think that's an important thing. The important thing to understand is that housing is a different problem than the problems of homelessness funding and homelessness. There's a narrative out there, and this goes from the National Alliance to End Homelessness to the National Low Income Housing Coalition to the Department of Housing and Urban Development. And the narrative is people are homeless because they can't afford the rent.
Yeah, I know that's not true.
And it's just not true.
But on the streets of Salt Lake City, I did a story based on a survey I did. I just went and asked 10 people, would you want to work? And I cherry picked. I picked the people who could talk to me, who were coherent, who looked healthy. 7 out of 10 said they could.
Sure.
Johnny said she could work limited hours. A lot of people said, no, I'm told I can't work. I'm told by my caseworker I cannot work.
Right.
But the 7 out of 10 who said they could work, I'm working with restaurant owners all the time. One guy, he owns 4 restaurants in downtown Salt Lake City, said, I would love to start a homeless work program. I understand these people are unsheltered. I would be willing to put up my own money, help them get housed. Just the only requirement is to pass a UA.
Right.
And you can't come to work high. If you get high, you're not allowed to come here. But if you consistently do that, we would love to have you work for us. And he's desperate, like most restaurant owners. And there's the workforce sitting there in this drug-infested cesspool.
And there are programs that do that. I know that in Portland, actually, there's an organization called, oh, goodness sake, the Central City, I think it's called Central City Community, and they have a workforce training program.
Yeah, and they had it in Salt Lake City in 2019. I learned under Chris Burbank.
Yeah.
And Himalayan Kitchen owner tried out 5 people. Half of them stuck past the second week. Like, a lot of them are going to say they're going to work, but then they're not telling you the truth.
There's a big reality. What we need to understand is that there are significant challenges for people who are experiencing unsheltered homelessness, and we have to be able to partner with these people, not just simply, this is part of the tragedy is the funding that comes from the federal government, the state. It's very thin. I think the Salt Lake Valley Continuum of Care gets something like $13 million a year from the federal government for COC funding. It's not a lot of money.
Yeah.
So on the one hand, it does restrict the capacity of what can be done, but it doesn't have to be the end of the story. I mean,
but is HUD going to say, you as a business owner, for example, our business, we need drivers. We always need drivers. I have a little bit of extra land. I know this wouldn't probably work, but why couldn't I put a couple boxable homes over there? There's a company that makes prefab homes that you can just plop in place, and you set up the utilities, and it's done. But could there be any relaxation for business owners who need employees to set up ADUs on their premises? Could that ever become a solution?
It certainly could. I mean, it's certainly not contemplated, and it's not prioritized right now in the way that HUD funds communities to assist homelessness. So this is the challenge. So we've got this housing bucket. We've got this homeless funding bucket that's very restrictive and very challenging. It often doesn't go far enough even in the small things that it's trying to do, right? We have this other bucket that has to do with treatment. So we're kind of, putting together challenges of individuals, some who have housing needs, a lot of housing needs, some who are categorized as homeless, some who have significant challenges with respect to treatment. I think one of the biggest things that is tough when you're doing street outreach and you're understanding this big kind of broad, almost meaningless term of homelessness is we have 5% of the public psychiatric beds that we had in 1950. We have disinvested and eliminated 95% of the public psychiatric stock in our entire country. It is very difficult for people to get the treatment they need with a serious mental illness and be able to stay in a place that they're actually going to meet their needs. With respect to substance use disorder, I just met yesterday with a whole room full of folks who are into recovery and treatment programs, but there's challenges there too. If you know anything about Dave DeRocher and the Other Side Academy,
he sat right where you are.
He talks about the inadequacy of a 30, 60, 90-day reimbursable drug treatment program. Folks need, the data suggests that folks need 18 months at minimum before they really stick into recovery. Yeah. So we have these disincentives that impact what happens to people on the street. So we've got the housing bucket, we've got the homeless funding bucket, we've got the treatment bucket, and the last bucket is, some people call it the enforcement bucket. Some people would call it, I call it regulation of public spaces. Johnny on the video was kind of alluding to the fact that why can't I just be left alone to live in a public space? Well, the reason is because it's not your space, it's the public space.
Well, she actually called for a piece of ground, and that's been in the works supposedly for years. A sanctioned campground.
Sure.
They do it in Denver. Our mayor goes to Florida to look at their model, but doesn't bother to go to Denver to see how a sanctioned campground would work. What's preventing Salt Lake from opening a sanctioned campground?
I think the biggest challenge, I spoke with Wayne Niederhauser earlier this week, and he said, look, the legislature just appropriated the money for me. Now I've got to go and find the land. Mm-hmm. So now you've got the government with money that the state has provided to go out and compete with everybody else for valuable land. Yeah. So that's what's preventing Salt Lake from providing land. And that
Salt Lake and Utah is run by developers.
It's competitive.
Nobody wants a sanctioned campground next to their development project.
So we, and again, a sanctioned campground, I'm in favor of sanctioned campground. I'm in favor of more shelter. I'm in favor of more housing. But I'm in favor of these things done right and managed well.
Yeah. Okay, well, that sounds awesome. I hope that we can make significant movement because obviously it's only getting worse, and they're trying to the policy is a moratorium on any more homeless shelters in Salt Lake City, and that was like a move that city made to
but that's coming
make
up.
The county.
That measure is going to be coming up again in early April, I think April 4th. And we're looking at that policy to cite additional homeless shelters. One thing that's troubling us as we read this initial ordinance is to use the administrative authority of the city of Salt Lake for conditional use permits for what they consider quote unquote small shelters of 40 people or less. Mm-hmm. There's nothing to suggest that a shelter of 40 people or less are going to have any less or any more impacts or the same impacts of the Gail Miller Resource Center with a couple hundred or 300 beds. Yeah. So we've got to be very vigilant to suggest that, look, this is citing a homeless resource center is not the same thing as opening up a coffee shop. It's not the same thing as opening up, a commercial building. There are significant impacts into the community, and we need to take those into account. And when we don't take those into account, people are paying for it. Businesses are paying for it. Residents are paying for it.
It can deteriorate a neighborhood so badly if people are not going to work every day or improving. If the drug trafficking is increasing, sex trafficking is increasing, as we've seen happen in Ballpark. But thanks so much. I know you got to go.
No
really
problem,
appreciate
Rich. Thank you so much
Paul.
for your time. I appreciate the opportunity.
Yeah. All right. And we will be back with another interview next week. We're going to keep following this. We're hoping to have people from the Salt Lake City Homeless Task Force on the program, and we'll be showing more clips of more homeless people. So stay tuned, and we'll talk to you later. Bye.